When families have relatives they're trying to care for as they reach end of life, it's challenging. It's a struggle. Gulfside Healthcare Services is transforming hospice care by offering many unique patient and family services. And we are joined now by Kathleen Postiglione. She is Chief Operations Officer and Business Innovations Officer, and Dr. Lisa Barker, who is Chief Medical Officer with Gulfside Healthcare Services. Hello to both of you. Thanks for being here.
Thank you.
Thank you.
We want to share with our audience some of the big news that's impacting your service area. That's exciting.
Yes, we're very excited that now we will be able to offer hospice care in Hillsborough County. And this is part of our goal of expanding access to healthcare services throughout the Tampa Bay region.
Dr. Barker, I want to talk to you a little bit more about the unique services that Gulfside provides, because you have palliative, hospice, and you do all of it together, but there's some really unique things about Gulfside.
One of the programs that we're really proud of is what's called the Gift of Time. And this is for families who have made that decision for their loved one that it's time to remove them from advanced life support, such as ventilators. And we can move those patients to our inpatient care centers in Pasco County and be able to allow the family to gather and have a couple of days to be able to say goodbye while we're still maintaining them on that ventilator before they decide that it's time to remove them from that. This gives the family time together and say goodbye and really be more at peace in a loving and caring and empathetic setting rather than in a hospital setting.
Absolutely. It's so important to have that experience, and it doesn't have to be scary, being supported by those wonderful people that make up your organization. I also want to talk with you, Kathleen, about what you're able to do looking back 35 years you've been serving this community. You've come a long way.
We certainly have, and we started as a very small hospice organization. As we started working more with the members of the communities, we realized that there were other healthcare services that they needed. So we added on palliative care and then eventually home health care as well.
So as far as families, patients, what are costs involved, or how does that work?
Hospice is covered by Medicare, and therefore there's no cost to the family if the patient is on Medicare, and all of the commercial insurances and Medicaid also have hospice benefits. So that's one of the myths of hospice, is that it's expensive, while it's actually provided at no cost to the patient. And that includes all of the services related to the patient's terminal prognosis, including nursing care, medications, equipment, and things such as that.
Kathleen, I've spoken with you prior about, and off-air, just about the wonderful people there at Gulfside. And share with us a little bit, I mean, you look at that and you say, oh my gosh, that must be a tough profession to be in, to see that all the time. But it's actually, in some ways, it's quite rewarding.
It definitely is. I know I felt that when I first came to the organization and had the experience with hospice. What I find with people that are involved with hospice care is that they have a passion and they do care, and they take it very much to heart to make sure that they're supporting the patients and families through the medical experience as well as a complex healthcare system. Absolutely.
Well, we want to let our viewers know where they can find out more, especially when you get into that, you have a loved one in that stage of their life. It's nice to know, hey, we have the resources to reach out to. And there you see on the screen, gulfside.org. You can also call 1-800-561-4883. Thank you both so much for your time today. Appreciate it.
Our pleasure.